Hi fam, it's Dr. Chinasa here. So in the event that you find out that someone just slumped or someone is unconscious, either following a drowning or an accident or just slumping, it's important that you apply the basic rules of CPR, the basic rules. And I'm going to tell you the 6 steps that you should know. First, step 1, ensure that there is no danger around you. Immediately you come as the rescuer to the person, you ensure you look around and be sure that there is no car coming, there are no sharp objects around you and the person, that both of you are safe. Step 2, it's important that you check for response. Hello, ma'am. Hello, ma'am. Can you hear me? You shake her shoulders. If there's no response, you can pinch a little bit. If you can check for pulse, you check for pulse. Hello, ma'am. Can you hear me? What's your name, ma'am? What's your name? No response. Step 3, shout for help. Immediately you pick your phone and you call 112. In Nigeria, that's our 119. You call 112. In the event that 112 doesn't work, you quickly shout, hey, anybody there, beg, you there, beg. Who gets Sienna? Who gets boss? I beg, go find with the call with the go hospital. Any hospital there nearby. I beg, make it arrange. I beg, quick. You call for help. Better to start looking for someone that has a Sienna or someone that has a boss, so that the person is stretched out and you're still applying CPR while going to the hospital, just in case you do not have a hospital number to call or 112 does not respond in Nigeria. Step 4, you open the airway. What do? You quickly take the person's head and tilt it a little bit just to open up the airway, and you check, is the person breathing? You listen for normal breath sounds. Any breath sounds, if there are no breath sounds, you look at the chest. Is it rising and falling? It's not. You quickly start chest compressions. Now, how do you do chest compressions? You are meant to compress the chest. Now, you can easily find that midline or from under the arms, draw a line to the center of the chest. Your first hand, the heel of your first hand, flat on that point. The second hand is curled over the first hand. See, it's important that your shoulders are over the person and your elbows are locked straight. Okay? Now the goal is to give 30 chest compressions. So we are going 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 30. Okay? And then for each 30, if you're up for it, you give rescue breaths. How do you do the rescue breaths? You quickly, you remember you tilted the head a little bit, your mouth over the person's mouth, open in, and you breathe. While you breathe, your eyes are on the chest to see if it's rising. If you're not up for rescue breaths, skip it and continue chest compressions. You see, the reason why this is your shoulders are above is so that the depth, you are getting at least 1/3 of the chest depth. So you continue. The goal is that you're doing 100 to 120 compressions per minute. This can be very exhausting. So you got to find nearby. I bet anybody where fit come, anybody wants to do this thing. I bet who they be. I bet come help me. I don't tire. You they shout. I bet they don't get a Sienna. You they organize. Which are you counting? And you're doing. You are moving until either the person starts coughing up or the person starts breathing normally, then you turn the person into a rescue position. Okay? But it's always important that the person has a flat surface on their back and you are applying chest compressions while calling for emergency. And immediately, if the ambulance doesn't come or 112 doesn't respond, you continue these chest compressions until you get to the hospital emergency. That is very important. That's why now why you go to find Sienna or you find boss, because the person got lie down and you got the drum. You understand? This is very important. Please, you can save a life by knowing this simple technique. A bad chest compression is better than no chest compression at all. So please learn this basic routine and try it, and hey, save a life. God bless you.